the change we want will come. It will come because women will demand it, and because they will implement the change that they want to see. The second reason that ATU has joined with the UNFPA, the Ministry of Health in Africa, CDC, is because we believe in the power of partnerships. Together, we can amplify our impact and create lasting change. We are stronger together, and by collaborating with like-minded organizations, we can achieve, all of us, our shared goal of advancing women's health and rights in Africa and beyond. The Arkan University has always aimed to deliver international quality, high quality education, research, and healthcare to the women and girls it greatly serves. But to improve quality of life for the majority of women, we will need to do much more than that. We need to work with the public sector, with local actors, and with global leaders. If we want evidence to translate into impact, we need to make partnership a priority. That is what the UNFPA, Ministry of Health, CDC have done, along with many others, many of you in this room. And that is what the Arkan University is doing through its Center of Excellence in Women and Child Health, and its many other academic and research entities. I must also take a moment to commend Dr. Marlene Timmerman for the work that she does to impact for her leadership and the positive role that she has played, her dedication to advance the cause of women and child health improvement. Thank you very much, Marlene. The Arkan University deeply values its partnership with the Ministry of Health. Its collaboration with public hospitals such as Pumwani Maternity Hospital and Coast General Hospital, and its long-standing and very, very fruitful partnership with the Kilifi County. We are proud also of our work with UNFPA and other UN agencies, the Gates Foundation, Wellcome Trust, Philips, and the governments of Canada, Belgium, France, Germany, along with the European Commission, to name just a few.
If we can change the fragmentation, if we can fund, with our hearts and minds wholeheartedly. Thankfully in Nairobi, after all, the home of the Nairobi Summit on ICPD 25, I feel on solid ground. You here are the epicenter of a thriving innovation ecosystem, and with your top-notch health and research institutions, Kenya is indeed a frontier for innovation now in women's health. That's going to be a boon for Africa, but it's also going to reverberate globally. And when we talk about being a catalyst, that spark has to really light a movement that again is going to prioritize the health, the needs, the wishes, and the understanding of women and girls everywhere. This is what UNFPA has been doing. It is not a distant dream for us. A lot of my team is here with us. We have metrics for everything we do, right? Data and metrics count. And I am simply here to ask every young scientist, every policymaker, every funder, every entrepreneur, every advocate, every student to commit to being part of the solution.
I think finally, and this has been asked, repeated, we must invest. We must invest in this. And hopefully we have local philanthropy, we have a lot of our private sector companies. Africa is getting richer in the sense that we are having a more middle class. So part of what we must do is invest in ourselves.
Let us be a little bit future thinking. Let us think about there is abundance of funding and financing. We have enough resources to invest in innovations in women's health. And a few years from now, each of you give me one or two innovations in women's health which you think will be a true game changer.
A game changer is education. So it may not be something that we're going to face back to focusing, but if we invest on education, again, I'm sure it's an innovation that can change the lives of women and girls in this country. In Kenya, every year more than 300,000 girls get pregnant below the age of 18 years. Many of them are because they cannot go access education, many of them because there's early marriages and other issues. So I think focusing on education is again another game changer. And those are what I'll just say. Thank you very much.